Hi everyone, happy Wednesday Wellness. And today we're going to talk about adrenal fatigue. And this is something that we are all collectively experiencing right now. So it's something that I wanted to talk about with Dr. Keith Berkowitz, my colleague. We've both been seeing patients for years and years. In the last 20 years, I've been testing a lot of patients for adrenal fatigue because we have symptoms such as unexplained fatigue, dizziness, standing up quickly, skin issues, acne. All of those things come from adrenal fatigue. And this is something we're all experiencing. And I want to welcome Dr. Keith Berkowitz. He's joining us live here from New York. And we're going to talk about what is adrenal fatigue, what can we do about it, what tests can we do to assess it, and even lifestyle changes that make a huge difference. So you guys keep on here and ask your questions at the end, and we will do a Q&A. Keith, how are you today? How are your adrenals, more importantly?
Much better after I just took my 45-minute walk.
Yeah, I do find the walks are very meditative, and I was doing that at the beginning of quarantine, and then I just, what's happening is we're working harder and longer than before quarantine. And you and I are also doing a lot of virtual patient visits, which, you're on the computer all day long and you don't get that physical interaction with patients. So it's almost, you and I were talking about this and we were saying how we're feeling a bit more tired doing that.
Everyone tells me in my practice, every minute they commuted, that's gone. Now they're working 2 minutes more for every minute they've given up.
Right. So for every minute they would have commuted, they're working. What is wrong with us? Why are we in this rat race? Why are we, and I think part of it is with the COVID-19 pandemic, things have become more difficult. It's difficult, daily life is difficult in terms of, things that you used to be able to access before, travel, everything is more difficult. So, your body is working harder to do the things to accomplish the same goals. So I think that's definitely one of the big reasons. So we are talking about adrenal fatigue. There's been some doctors that have coined it the 21st century disease or illness or syndrome. And, I see it so often in practice, and anyone with hormone imbalances or mood fluctuations, they need to assess their adrenal function. And what does that mean? And we'll go over all of that. First of all, Keith, let's describe to everybody listening, what is adrenal fatigue and why does a conventional medical system poo-poo it?
So this one is very special to you. You know why, right? So this was actually coined by Dr. James Wilson in 1998, who happened to be a naturopathic doctor.
Right. Exactly.
So this is one special to your heart. So what's interesting about it, I think this is a condition or a medical issue that's often confused. And I think oftentimes people think of an adrenal problems as something we call Addison's disease.
Right.
So Addison's disease is when your adrenal glands don't work. What really adrenal fatigue is, it's really, well, I would say your adrenal glands are normal, but they're overextended. So over time, they become overstressed, overextended. They no longer can compensate for your body's additional needs. And then they, what I would call almost burn out over time or fatigue.
So for everybody listening, stress is completely normal, and it's actually good to be in a situation of some stress because it keeps your body running, it keeps your body alert. All of those things are protective mechanisms. It's when you continue to think that the tiger is running after you when it's not. And it's also a state where when you continually go into that state of stress, your body, the neuroplasticity in your brain has those similar, they're used to those sort of triggers, and it's hard to get out of that cycle. And think of it this way. I like to look at it as a bathtub that you fill and fill and fill. It's the same way of the toxin theory. And there's a plug in the drain, Keith. There's like too much hair in there. Not gonna be yours,
I don't have that issue,
be
by
mine.
the way.
And it plugs that bathtub. And so what happens is when you keep the stress keeps going, it overflows, and the body systems cannot cope with the stress anymore. In the same respect of this pandemic, what is interesting is we're all collectively all over the world going through the exact same thing. So every day is a new day. We don't know what medical, Keith and I are on top of all the information, and the top immunologists, and trying to find out what's going on with this condition and how it's affecting our patients. So every day there's something new. We're waking up to not just new in a good way, but new in an uncertain way. And when there's uncertainty, that's when there's stress. And for all of you out there, we're all experiencing adrenal fatigue. You, Dr. Keith Berkowitz, our patients, and we want to be able to say, okay, fine, we're going through this. How can we actually cope with this and treat it and make it livable?
So interesting about these adrenal glands. They're like little tiny things.
They're
that
so
sit on top
cute.
of our kitties.
Yeah.
Cute but powerful. So it's
Super
interesting.
powerful.
People forget that they're really responsible for overproduction of over 50 different hormones. And I know we talked about stress hormones, but actually there's another hormone we just talked about last week. It's your sex hormones also are produced in your adrenal glands. So not only does it affect your body's ability to deal with stress, it also affects your hormones and your body's ability to have a normal cycle and to function normally from that aspect as well. So these little tiny things really can drive us crazy.
They can. They can drive us crazy. And they're about 20 to 30% of total hormone support. So say you're on bioidentical hormones, or you're on the patch, or you're on hormone replacement therapy, or you're on the birth control pill. That alone is not going to support your hormones. If you don't treat the adrenal glands, you're not going to treat the root cause.
Yeah, I think what's complicated for people is we think of a lot of medical conditions, right? We do a test. We test your blood sugar. We test your cholesterol level. But the adrenals and adrenal fatigue, there's never been really a clear-cut diagnostic way of describing it. People talk about cortisol levels as one example, measuring our stress hormone. The problem with that is, first of all, people don't always measure it at the correct time, right? They'll do a blood test at 8 a.m. or 12 p.m. or at nighttime. And what ends up happening is you get numbers all over the place.
Right.
But what's really important is really seeing and look at things like circadian rhythm. We always talk about, structure. We talked about last week, how going to sleep when it's night dark out and waking up when it's light. And what we learned about that is actually measuring these hormones and cortisol, for example, throughout the day. And what's interesting is our normal blood tests are not the proper way to measure it. So it's not our normal way to do it. It's actually a test you have to do at home, where you either do it in the urine or through the saliva, and you have to collect multiple samples throughout the day and look at trends in that hormone.
And even if you wanted to do blood, you'd have to come in the morning, noon, afternoon, and midnight to get your blood drawn, and that's not possible.
I'm not coming in to draw people's blood at midnight. I'll tell you that for sure.
So the
Then I'll have adrenal fatigue.
Exactly. Yeah, exactly. You'll end up with adrenal fatigue. The saliva is a really good way of testing because it's measuring free hormone. So versus, it's unbound. So we can actually see the activity of your cortisol. Cortisol, folks, is a hormone produced by those cute little glands. What are they called? The adrenal glands. And when we're in a very stressful situation, cortisol levels go high. They're higher, than usual. When you continue to trigger that hormone cycle, and there are 4 stages, Keith, of adrenal fatigue. And the 4 stages, initially you start off with a bit of, fatigue, you get your cortisol levels go up. And then we talked about, as you continue to progress with the stress, you don't do anything about it, you don't meditate, you don't take supplements, you don't sleep on time. All of those things then cause eventually what I call a flat line. Okay, that flat line is no cortisol. That means that the adrenal glands are done pumping all that cortisol and then are using different bodily functions to try to cope. So again, super, super important to manage that cortisol. And the things cortisol does is incredible. Keith, why don't you tell us a little bit about cortisol and what it's for?
So when you talked about that, first of all, when you talked about cortisol, and what happens is I think people don't realize it. So a lot of times when their cortisol levels are high, they develop what we call these maladaptive processes, and their body kind of burns out and they don't actually realize it until there's no cortisol left. And
Right.
that's one of the issues. So cortisol is your stress hormone. I always use an analogy in my practice. I use one. Say a mugger comes up to you. You want to actually have the energy to run away. So you get
Right.
this large cortisol surge to actually raise that stress hormone, but also raise your blood glucose level. One of the mechanisms that cortisol works by is raising blood glucose. So by raising blood glucose, your body actually has more energy to work with. We talked in the past about things like reactive hypoglycemia. For example, one of the issues where people become symptomatic in something like reactive hypoglycemia is because of that excess cortisol, is that adrenaline rush, right? We think of all those hormones causing our system to become in a higher sympathetic state. And that is where cortisol, but when your body can no longer adapt to that, that's when the body really hits what we call adrenal fatigue or exhaustion. And again, it's not that the adrenal glands don't work, is that they're just not functioning properly anymore.
They're not functioning optimally. You know, think about it. When you're running away from a mugger, you're not going to go, oh, I need to go to the toilet and go pee. Last thing you're doing, because your body is in sympathetic mode. And when you're constantly in sympathetic mode, you're really messing around the nervous system to make it feel like it's always in fight or flight, when really it's just, you know, a type of stress that we're not dealing with or coping with very well. And then when we look at cortisol, we now look at research, Keith, and you and I have seen this over and over again in practice, is that cortisol actually causes the endothelial lining of our blood vessels to actually to scar in a way. And so then this is what we have is atherosclerosis, and that's when the plaques can sit. So it's not all about cholesterol and having high cholesterol levels. It's about that beautiful endothelial lining of the blood vessel actually getting damaged from the pounding of the cortisol. And cortisol, if it damages those endothelial cells, what else does it damage? So it causes premature aging, ladies, sagging skin, wrinkles, acne, all of the things that we don't want. So it's a question of how do we control cortisol by controlling our diet, lifestyle, and supplements. Also, the other hormones releasing is norepinephrine and epinephrine, and also DHEA. And those like norepinephrine and epinephrine, the adrenaline hormones cause your heart to increase, the rate of your heart to increase. So we look at increased risk of stroke. So people that are under high amounts of stress, you see like a lot of CEOs, heart attack, stroke, you see those quite often in those individuals. And now with all of us in that situation, we're all at risk for this fluctuating cortisol.
And you brought a great point. I'm sorry to interrupt. So with the atherosclerosis, what people don't realize is then what happens is that causes high blood pressure. So
Right.
then the body, to compensate, has to increase their blood pressure. That's actually a higher workload. And you talked about as that blood pressure rises, the episodes of stroke or the incidence of stroke goes up tremendously.
Right. And so, you know, some of the symptoms when you and I posted our post yesterday, a lot of people were like, that's me. I have, adrenal fatigue, so people that have, I was talking to a friend of mine in London. She's with us now. She's an esthetician. Her father is going through issues where he's got dizziness, standing up quickly. He loves sugar. She's like, I think my dad has adrenal fatigue. And so, it's that connection with blood sugar and adrenal fatigue. Keith, you're the blood sugar king. Would you be able to describe exactly what's happening with, people who crave a lot of sugar and who have adrenal fatigue? That connection,
sure. So
that reactive hypoglycemia.
So I'll start again with the mechanism. And then I'll talk about blood pressure too afterwards, because it's interesting as well. So what happens is, again, we talked about how cortisol's increased. So cortisol's role, again, for the mugger example, is to say, okay, let's get more glucose on board, right? So it's looking for glucose stores. The problem with that is, guess what comes along with glucose every time? Insulin, our inflammatory marker, our fat-storing hormone, our evil villain and PCOS, all those things together. And then what happens is that then causes all that glucose to leave the bloodstream and go into the cell, and then the glucose in the cell to crash. In the bloodstream to crash. So when that crashes, then your body says, uh-oh, I need more cortisol. And then you get another adrenaline response. You get those cravings, you want more sugar, and then you have more sugar, then cortisol goes up, glucose goes up, insulin goes up, glucose goes down. cortisol goes up, you end up with that vicious cycle. And oftentimes people feel that constant urge to eat or hunger, or even symptoms like dizziness, lightheadedness, palpitations, you said before, with the fast heart rate, sweating, anxiety, all because of that unstable blood sugar and literally being pushed by cortisol. Another example of this, and I'll bring another, is when people go through surgery, right? And we've seen this with diabetics, they still get half their insulin dose because the stress of the surgery still causes that glucose level to rise. Mm-hmm. And so they have to have insulin to match that cortisol rise or glucose rise. So again, cortisol and stress, and I always think of when I look at blood sugar, that's 50% of the cause, whereas food is probably 50%, but 50% on the other hand is cortisol. And now blood pressure. So one way actually I look at and measure, adrenal fatigue is actually I do what we call orthostatic blood pressure and pulse. And what that means is I take someone's blood pressure and pulse first lying down, sitting up, and then standing. Oftentimes when you see a drop in blood pressure as you rise and an increase in pulse, that means your body is having to work harder. We use the word intravascular depletion. The body may be dehydrated, but also people with this chronic adrenal fatigue often have those symptoms where if they do get up too quickly or from a chair or from sitting a long time, they feel lightheaded or dizzy when that happens.
So again, these types of, understanding what your body's going through, I think is super important in order for you to make the changes in your body. So Keith, what are some of the ways, in which we can test? I talked about salivary testing. You can go to your doctor's office. So people that listening are like, oh gosh, I really want to find out, do I have adrenal fatigue? I know, Keith, you and I both do virtual consultations. There are other, find a naturopathic doctor or a functional medicine doctor in your area that can do a saliva adrenal test on you, because that's really going to tell us where you're having the problems with cortisol and DHEA. And also we'll measure things like secretory IgA, progesterone. What else does it test in there? Insulin as well. So all of those things would be interesting to know through salivary test. And then Keith, what do you think about the cortisol test for urine? Because you can look at the breakdown, but I don't know if it's as accurate as the
problem is a lot of the testing requires what we call a challenge, right? Yes. So in order to measure cortisol properly, you have to have a challenge to see if your body is making cortisol in response to stress. Unfortunately, that's kind of complicated and often has to be done at his doctor's office. I agree with you. I normally will do those 4 different saliva-based cortisol measurements. And again, with DHEA. And as you said before, people forget cortisol and DHEA are sometimes in competition. They compete for resources. So when cortisol's high, DHEA will often be low. And again, DHEA is your precursor to testosterone and estrogen. That's going to affect your hormone function as well.
And we've seen a lot of patients burn out and lose their DHEA. DHEA is a mother hormone to all hormones, and we need DHEA. It's really good for people who have autoimmune conditions, who are perimenopausal, athletes, people trying to build muscle. A lot of these people that are burnt out and have trouble building muscle is also because their DHEA levels are low because they burn through it. And so, this is something for us to really investigate. And of course, we can put you on supplemental DHEA, but we need to look at the root cause. So we're not just throwing supplements at you and we're treating, why it is that your adrenals are failing. Like, what are your sleep-wake cycles looking like? And when we do the 4 different saliva tests, we can see where the problems are.
And often in adrenal fatigue, what you're saying is we actually see almost a backwards pattern where people have low cortisol levels in the morning when that's normally should be high, and high cortisol levels at night when they should be sleeping. That's not a good thing. You want to be.
That's like you're on European time, or you have constant jet lag. Those are those people, Keith, that are wired and tired. How many people are wired and tired? Give us send us a message here, because I'd be very interested to know, because wired and tired means it's evening time and you're physically tired, but you're just not able to shut down. And when you're lying in bed, you're like, do I need to count sheep? What do I need to do to turn off my brain, right? So I see a lot of people, oh gosh, so a lot of us are wired and tired.
Think about what's more
you
frustrating,
see,
right?
look at this. This is like crazy. There's so many people.
What's more frustrating, right, Nigma, than being so tired that you can't sleep,
Yes,
right?
and
That's like the ultimate punishment.
that's the ultimate punishment. And the cravings kick in. You know why? Because your cortisol levels, that hormone is going up, and that is making you crave something to eat, something sugary. And so people who have that are tired and they're wired and tired, and they're craving sugar at night, wow, you've got some, we need to work on bringing down that cortisol in the evening. And again, those are those people that end up gaining weight all around their belly. And that's the insulin resistance. Keith, there's also a massive connection between the gut and the adrenal glands. And I was just remembering, this research that I read was, they did a study with mice, and they had them with toxoplasmosis gondii. They injected them with this unfortunate, and these mice ended up liking cats as a result of it. And so it really messes up your brain chemistry. Your gut microbiome dictate exactly what's going to be happening in your brain. So all the creatures that are living in your gut are dictating how your head should feel. So these poor mice ended up not dying of the illness of the toxoplasmosis gondii, but they ended up dying because they put themselves in front of the cats because they became friends. They thought the cats were their friends. That's how delusional they became. And so it's an interesting thing how our gut microbiome can actually change our brain chemistry and can affect our sleep-wake cycles, and also affect our melatonin production, which helps us adapt to sleeping at, in the dark. So the gut and the brain, the gut and the adrenal connection and the brain connection are massive. Keith, do you want to elaborate on any of that?
Sure. When we think about a gut, we call it permeability, right? Everyone heard the word leaky gut before. So the gut actually it's almost like houses connected. They have these junctions, we call tight junctions, that keep all the bad things out. The problem is when you start having high cortisol levels, it actually damages those junctions and creates actually areas of we call inappropriate permeability, where actually toxins get through. I mean, if you look at the key to most diseases, right, we talk every week about chronic inflammation. Well, chronic inflammation starts in the digestive tract. One of the main causes of chronic inflammation is cortisol, right? All that increased cortisol is affecting your blood sugar, is causing insulin production, is causing chronic inflammation. The other really key point is our neurotransmitters you started talking about, is a lot of that production is in the digestive tract. Serotonin, dopamine, norepinephrine, epinephrine, those are all there. So if you are actually digestion's a mess or inflamed, and again, chronic cortisol does that, that's going to affect mood, it's going to affect energy, it's going to affect, our memory, all those things that our brain is needed for every day are going to be disrupted.
So folks, listen to this. Serotonin, which is your feel-good hormone, which is why people go on antidepressants, okay, and then they feel better after being on antidepressants for a bit. Serotonin, that feel-good hormone, 90% is in your gut. Okay, so if things go wrong in your gut, you're going to get anxiety. The anxiety is going to lead to depression. The anxiety is going to lead to adrenal burnout. So we have to always start, and I know some people might get bored of hearing me say this over and over again, but the gut is the gateway. The gut is the key to everything. If you want to fix anything, it could be adrenal fatigue. It's like, oh, I'm having this problem. Start at the gut, and I promise you, you will fix all those issues.
It's so interesting. It feels like we're talking about similar things every week, right? Fix your blood sugar, fix your digestion. Again, those are your foundational components of your body where everything really is based upon. No foundation, the house falls down.
Exactly. Did you have anything else to add to that before we go into what we can do, lifestyle, diet, all of those things?
So one of the things is, and to talk a little bit about cortisol, you actually don't want no cortisol. That's really important to think about it.
Right.
You want some production of cortisol. I always think of, I like this upside down U. So having no cortisol, your body, you don't get up in the morning, but you have to have the right amount of cortisol to function.
Right.
And then when you have too much cortisol, your body goes into overdrive. So
Right.
you look at that cortisol managing right there. And
this one has, this one's adrenals are perfect.
So what happens is you need cortisol, but you need the optimal amount of cortisol. And that's really the key. And again, in most things we talk about, too little or too much is both problematic.
Yeah. Too much or too little. It's like Goldilocks' porridge, I say to my patients. We want it right in the middle. And you know what's so satisfying, Keith, is when I redo my patients' adrenal profiles after they've been on the plan for, listen, guys, this could take up to 6 months. This is not a 1-week solution or a 4-week plan in a book. It's not, guys. It's 6 months. And, it's not all about, you don't have to be ridiculous about it, but imagine you put 3 to 6 months into your adrenal glands and it's a lifetime of youth and wellness and beautiful skin and feeling great and not feeling wired and tired.
Or fired.
Or fired. Yeah, I mean, everybody right now is, Keith, either undergoing marital issues, stresses, with their children, kids not going back to school, the fear of like what the virus can do to you. There is so much that people are going through right now. And so everybody's adrenal glands are to the max. So we really need you guys to take on this advice, because by doing this, you're going to support your immune function and keep yourself optimally healthy. And this is a key, is if we can get the masses to do this, then we're going to have less of a problem on our hands. And, it really starts with yourself. And you don't have to be a millionaire to buy all these supplements. Some of these you can get, they're not very expensive, some of these supplements. And also some of the lifestyle stuff we will recommend you do are not going to cost you an arm and a leg. Let's talk about what can we do to treat adrenal fatigue, Keith? Like, what are some of your, everybody's different, guys. So and we're not your doctors, so we're not going to be able to advise you in particular, but we have some questions we'll, look at in a few minutes. But Keith, let's start off with some, should we talk about supplements maybe?
Sure. Yeah, absolutely. Your husband is one, magnesium.
Magnesium, yeah.
So magnesium is really important for blood sugar regulation, is a big one. My favorite one, and I've talked about before in COVID-19, is vitamin C. So vitamin C is really necessary for your body to adapt to stress. In fact, there's a lot of studies now showing that people who have a viral infection and end up being hospitalized, one of the things they'll show on their lab results is low vitamin C levels. And in order to mount what we call a stress response, you need enough vitamin C to effectively do that. So it's really
your adrenal gland. Think of your vitamin C like gas for your adrenal glands. When you're burning yourself to the ground, it just really eats up all that vitamin C. So vitamin C is so key for adrenal function. Magnesium, super important for the mitochondrial cycle, for giving energy. Magnesium is one of the most deficient minerals when I look in patients with adrenal fatigue. It's chronically low.
About your mitochondrial cycle, CoQ10 is another example, coenzyme Q10, which is a cofactor in the Krebs cycle, which actually helps you produce what we call ATP. ATP is kind of the gas your body runs on. Mm-hmm. So that doesn't happen without that being present. And then it's my favorite group, B vitamins, right?
Yes.
B vitamins come up again and again. The one that's so important is B6. And B6 is really necessary for your adrenals to function properly. And again, another one, B12, gets depleted very quickly when your body's under stress. So it's like you said previously, a B complex is so critical. And then your favorite group, the adaptogens. Right. Sounds like the Avengers, right? It's a new superhero team. It does, the adaptogens. So again, these are a group of things that help your adrenals work better. One of the most popular ones we talk about is ashwagandha. Is one that people use. A lot of times they use in the evening to help with sleep. Another one is rhodiola, is a one that's used very commonly. Holy basil. All these actually help your body adapt to adrenal stress. One of the key things and why they work really well, this group, is they don't make your adrenals work too hard. What they do is help them adapt to a stressful situation. You don't want to crank up your adrenals. Caffeine does that well enough. You don't need to add something else. You want to help them work better so that you can have the proper amount of what we call neurotransmitters. Those are your serotonin, your dopamine, your norepinephrine, to be present so the body functions better.
And also your cognitive function, it helps your brain sort of function a bit more, again, adaptogens, remember wanting your body to adapt rather than stimulate. We don't want to stimulate. Okay. And so what we can do is I can put a note of all these supplements on my one of my posts. And also B vitamins, again, help with methylation of dirty hormones out of the body. And in particular, B5 is super important when somebody's burnt out. It's one of the B vitamins that get depleted at the very, very beginning. The connection between low blood sugar and eating. So people also are not eating well, which is contributing to adrenal fatigue. Keith, do you want to elaborate on that?
Sure. And it's so interesting. This is the one time we can eat well. It's now, if you're forced to eat at home, there you have control, right, of any time.
Yes.
So what happens is, unfortunately, we've moved on to more alcohol, more caffeine, more sugar, and we've kind of created almost this roller coaster. And I think that the roller coaster up and down is what's really, in a sense, aging us, causing so much more cortisol to be produced during the day, causing more insulin, causing more inflammation. So by actually controlling the amount of what we call bad glucose, bad sugars, bad carbohydrates, refined carbohydrates, your simple sugars, that's really critical. Creating proper balance with protein, fats, and carbohydrates is so critical to actually managing this. Because remember, every time your blood sugar goes up or down, that's a cortisol response. So we don't want to have extra ones. We have enough as they are.
We have enough.
So we want to be able to manage that, and diet is so critical. Also, going with the digestion, having what we call easily digestible foods. Someone brought up lectins before. Lectins are much harder to digest, so they will create actually more cortisol secretion because of that.
Exactly. And also people who feel dizzy standing up quickly quite often could have a blood pressure issue, particularly in petite women who, don't have enough electrolytes in their diet. Sodium is one of them. People are so afraid of salt, Keith. Everybody's afraid of high blood pressure. Can you talk a little bit about Himalayan sea salts and adrenal fatigue?
So the two I look at the most is Himalayan sea salt and actually Celtic salt, are two more common ones. And what's interesting, in order to maintain what we call blood pressure, right? Internal blood pressure, we need salt. There's a great study that was done in Europe. So they cut out people salt from their diet 100%. Guess what happened? They had more heart disease. So no salt is not good. So the reason salt is so critical, especially in the summertime, salt is needed to keep fluid or hydration within the vessels. So without sodium, you cannot maintain that. And again, in adrenal fatigue, one of the things that helps people that often suffer from low blood pressure is adding salt. And it's the processed salt that's problematic because your body can't handle that. But where you have the natural salt, like Himalayan and Celtic salt, that doesn't create as much of an issue.
Yeah, don't get the table salt, guys. The second ingredient in table salt in America is sugar. So that's not going to help you.
That's like sugar and salt. Wow. Let's talk about it.
Yeah, can you believe that? That's like the second ingredient. I don't even, it's crazy. That's a table salt that you can buy. And then proteins. Proteins are so important, Keith. Let's talk about proteins.
So proteins, and again, and I always think of protein with fat together, that's the critical point of regulating your blood sugar. Again, think of cruise control. You want your blood sugar to be on cruise control all day.
I like that.
And when it's on cruise control, you're not having cortisol stress.
Right.
How cool is that, right?
Love it. I love cruise control.
We'll see you tomorrow morning, basically. That's what you want to say. Because my blood sugar is stable, I don't need cortisol the rest of the day.
Yeah,
come back tomorrow when I need to wake up in the morning.
Yeah. I love it. I love it. Let's go on cruise control with protein and good fats. And fiber, guys. You need your fiber.
Avocado, my favorite.
What was that?
Avocado, my favorite.
Avocados. Yeah, no one ever said no to an avocado. Okay, every day, good 6 to 8 servings of vegetables. in your meals. I would steam these vegetables, folks, if you have troubles with digestion, which most of us do. It's just going to help your body be able to break down those. Vegetables are hard to break down, Keith. They're really, really hard to break down. So really important to steam them and put some good fat on them. So you can spray some olive oil on top or avocado oil, coconut oil, all of those things, and maybe a little bit of ghee as well is fine. Super important to eat your vegetables with a good source of oil. Fruit. So, go light on the fruit, but eat your fruit with the peels, right, Keith? Because that helps balance blood sugar.
Inflammation. So we talked about things like quercetin, right, which is a citrus bioflavonoid, which is the skin of the fruit. Very critical. And a lot of the nutrition and fiber is in the peels. And that's why we talk about it. Where the sugars in some of the meat and in the fluid and the water of the, so that's important to kind of balance that out.
So we want to avoid things like bananas, raisins, dates, figs, things like that are like super sweet and then just spike up your insulin. So things like apples, papaya, kiwi, grapes, maybe just not too many grapes, not like the whole thing. Cherries are really nice as snacks because they've got the peels on them, but they're also quite sweet on the inside. But because of the peel, I think it helps with the fiber.
And again, if you balance it with some protein or fat, like almond butter or something like that, that's really critical. Right. Also, I try and tell people not to have too much fruit at bedtime. It will often cause them to get up at night to urinate or make it more difficult to balance their blood sugar.
Okay. I think that's good. Lifestyle. So again, people who have adrenal burnout, this is the people that are flatlined, that have no cortisol. Please do not go and get on your Peloton or heavy duty jogs in the morning. That is going to be the worst exercise for you. You need to be doing things that are calming down your neurotransmitter activity, because until you get back into those, and those people never, ever really, if you feel terrible after you work out, that is a sign that you should not be working out. And doing more meditative type exercises, breathing, believe me, and walking, believe me, you'll lose weight doing that more so than, hitting it hard. Anyone who feels good after exercise, that's a great thing to do. And I recommend exercise first thing in the morning because you want to balance your cortisol. You don't want to be having high cortisol levels at night where you're sitting there wired and tired, and then your cortisol levels are up and then you're craving sugar. It's like a domino effect. So any other additions to lifestyle, Keith, that you wanted to add?
Yeah, so there is a technique that people often use. We call it coherence. It's a form of biofeedback where we get our breathing and heart rate in sync. By getting our breathing and heart rate in sync, sleep is easier, blood pressure drops, cortisol levels are better maintained. Also, not watching TV before we go to bed. That's another one that has an effect, which depletes melatonin.
I know.
And so reading, and I always read a book. People know me, I read a lot of books. So, and it's not medical. So before I go to bed, I read something to relax so that I can go to sleep more effectively and sleep through the night. And again, one of the keys is you need to be able to feel well rested in the morning.
Yeah, this is true. If you're feeling unrested in the morning, there's something going on with your adrenals. Okay, we're going to go to the questions. Okay, let's see. We all have different needs in our gut, right? Like depending on genetics. Absolutely. I mean, the one common denominator is, we have the same anatomy in our gut. The way the way your body goes through something called peristalsis, which is the movement of food through the tunnel of the intestines, that changes person to person. And believe it or not, that will depend on your cortisol levels. They've looked at research with people with fluctuating cortisol levels all the time can actually change the way you digest your food. So absolutely, we're all individuals, and there is a genetic propensity towards some people having more poor digestive function than others. There's been some research around vaginal birth versus, non-vaginal birth. So, these are all, factors in how you're going to digest.
Yeah, and actually people with high cortisol often have low levels of good or beneficial bacteria. So those are the things you need to be able to digest effectively or need to maintain proper immunity.
I'm glad you brought that up. Elie Mechnikov, who was that Russian zoologist, I believe, and he was an immunologist. Both of his wives died on him back to back. He should have learned the first time, but anyways, both of his wives died, and he tried to commit suicide after. This was like all in the literature, and it was because he was so upset, he was so stressed out, and then he got into trying to understand death starts in the gut. That was one of his things that he learned, and he found that he started taking probiotics and fermented form of probiotics. And he lived till 71. And back in the day, the average life expectancy was 40. And he ended up, saying that, look, my last, 40 years were the best 40 years, because that depression that he had started in the gut. Obviously, he had noticed that. And he noticed that people who lived longer had better sources of diversity in their gut, in that jungle in your gut, and also had better good bacteria. So people with a more diversified gut, people with good bacteria, those communicate with the brain, and those communicate with how your body deals with stress. I just thought that was super interesting. I wanted to talk about that today because I love Elie Mechnikov and all his work. He's incredible. Death does begin in the gut, and
So on the other hand, life begins by maintaining your gut.
Yes. I love that. Keith, any thoughts on empty sella syndrome?
That talks about the pituitary not working properly.
Yeah.
So I'm going to not answer that because it goes into a whole different topic. But offline, they can contact me and I'll answer that.
Yeah. So send us a message and we'll talk to you about that, because that's like a whole other topic, and we need to talk about lab tests that you've done. How many portions of fruit per day is it okay to have in the afternoon? I recommend, like, if you're craving something, drink some water to start, see how you feel, and then if you're still craving something, cut up an apple. You can have like a couple servings of fruits a day with the peel.
And again, I always talk about combining with some protein and fat so that it stabilizes your blood glucose better. And remember, avocado is a fruit.
Exactly. Have some avocado. What probiotics do you recommend? Well, I mean, I created an amazing probiotic. There are a lot of good ones out there. The one I created has grapeseed extract in it, and it's a DDS1 strain, which is a strain that's been shown to survive the gut acidity, and it's a really good. I've had patients on it for since 2015. I've been putting patients on it. I've had excellent results because it's a DDS1 strain, lactobacillus and bifidobacterium. So those are, generally that's what I take every day, especially if I am traveling. I will never leave. I mean, I take them every day whether I'm traveling or not. But super important to dose them just one a day, with or without food, it doesn't matter. What is the best way to deal with food intolerances? To simply cut them all out? Well,
you want me to handle that? I can tell. I'll take that.
Sure, yeah.
So it depends on the level of intolerance. Again, so a lot of people, we think about food intolerances, is it truly a food intolerance, or is a gut problem to begin with, where there's chronic inflammation in the digestive tract? So sometimes I would actually hold those foods off for now, work on fixing the digestive issue, and then slowly reintroducing those over time to see if it's truly, an intolerance of the food, or is the food inflammatory to an already, problematic digestive tract.
So sometimes it can be a fake food intolerance because you've got some leaky gut going on.
I like that. Fake food intolerance.
And some of them are genetic. Like, listen, I tested my grandmother, I tested my dad, my sister, like everybody, because I wanted to find out where this garlic intolerance came from. And sadly, it is a genetic thing, and it's also molybdenum deficiency. So there are different reasons why we can't digest certain foods, or some genetic involvement. It's like a combination of environment and genetics. And it's something you really should speak to your naturopathic doctor or functional doctor about individually, because everyone is different. Everyone will require to be off the foods. I recommend taking them all out just to take the pressure off, and then, resupplying your gut with good bacteria, eating the right foods, and then see how you do after a couple of months. Okay, what protein do you suggest for vegetarians? Keith?
So things for protein, I think of sources like nuts, for example, are good sources of protein. If you're a vegetarian that eats eggs, that's helpful as well too. So those are good. Again, I like to think of protein sources that actually have some fat included and healthy fats, and those I would choose as probably my top two.
Okay. And, just, make sure that make sure you consult with a naturopathic doctor or somebody who can guide you and make sure that you are eating the right foods specifically for you and what issues you might be going through. Any kind of hormonal fluctuations, you need more fats, you need more proteins. So this is something definitely, we're all individually unique. And, if you are suffering from something, diet and lifestyle can be it's like prescribing a medication. If you're doing specifically what you need for you, it's fantastic the results you'll end up getting.
And no side effects, right? Isn't it the best part? It's
yes.
The only medication we know of without any side effects.
I love that. I love that. I want to end on that note. Thank you so much, Keith, for
thank you.
Coming on again to talk about my favorite topic, adrenal fatigue. Guys, if you have any recommendations on what you want us to discuss next Wednesday, we're doing these Wednesday wellness, and we're so grateful that you guys are here every Wednesday. And if you send us some, DM us some ideas and thoughts, and then we will talk about them in our next Wellness Wednesday.
We continue what we call the puzzle, which is the human body.
Does anyone want to talk about the COVID-19 situation? Because I know Dr. Keith is up and up on the research with that, and what you can do to support yourself. So that's also another potential topic if you guys are interested. Thank you guys all for coming. You make this so much fun for us, and great questions. We love you. Happy Wednesday and wellness, and we'll see you next week.
And be safe. Thank you.
All right. Bye-bye.